Are you a first-year nursing student struggling with your return demonstration and assessing the vital signs? Well, this video is perfect for you. Good day everyone! Today we will show you the proper procedure of the vital signs, specifically the temperature, pulse rate, and the respiratory rate, which are essential indicators of the patient's health status. Accurate assessment of these vital signs helps the healthcare providers to monitor the patient's condition and to detect any abnormalities early. Before we begin, let me introduce the amazing members of the Group C. We have the best among the best leader, the future head nurse, Isa, and the gentle caregiver, Nur. And we have the sunshine of the ward, Zhaida. We have our reliable duty partner, Sam. And we have the calm during an emergency, Nafi. And our compassionate healer, Ali. And we have our silent lifesaver, Mira. We have also the creative problem solver, Yang. And we have our rising star nurse, Zia. And last but not the least, I am Anna, the diligent future RN. For the first demonstration, we will show you the proper assessment of the body temperature, including the correct use of the thermometer and to ensure an accurate reading.
For the first part of our video, I am going to explain the assessment of the body temperature. So what is body temperature? Body temperature is the balance between the heat loss and heat produced by the body measured in units called degrees. The variation of the body temperature is due to the circadian rhythm. The lowest temperature occurs between 2 a.m. to 6 a.m., while the highest temperature occurs between 4 p.m. to 8 p.m. There are two kinds of body temperature, and those are core and surface temperature. Core temperature is the temperature of deep tissues such as cranium, abdominal cavity, and pelvic cavity, and it remains relatively constant. While the surface temperature is the temperature of the skin, the subcutaneous tissue, and fats. There are factors that affects the body temperature, and those are age, exercise, hormone, stress, environment, and diurnal variation or circadian rhythm. The instrument used to measure the body temperature is called the thermometer. Types of thermometer, and those are mercury in-glass thermometer, electronic thermometer, chemical disposable thermometer, temperature-sensitive tape, and infrared thermometer. And there are also three sites in assessing the body temperature, which are oral, axillary, and rectal. And now, Nurse Isa will perform the procedure on assessing the body temperature.
Purposes: to establish baseline data for subsequent evaluation, to identify whether the core temperature is within the normal range. Next is to determine changes in the core temperature in response to specific therapies such as antipyretic medication, immunosuppressive therapy, and invasive procedure. Lastly, to monitor clients at risk for imbalanced body temperature. Clients with infections, exposure to extreme temperatures, or impaired thermoregulation require close monitoring to detect early changes in the body temperature and prevent complications. Next is to assess clinical signs of fever such as flushed skin, chills, sweating, and increased pulse may indicate elevated body temperature and possible infection or inflammation. Assess clinical signs of hypothermia. Manifestations like shivering, pale skin, confusion, and slow pulse help identify decreased body temperature requiring prompt intervention. Assess the site most appropriate for measurement. Selecting the correct site ensures an accurate temperature reading and prevents injury or discomfort to the client. Assess factors that might alter core body temperature. such as physical activity, environmental exposure, medications, illness, or age that can influence temperature readings and should be considered when interpreting results.
So, good morning, ma'am. May I ask if you are feeling okay right now?
I'm good.
Okay. Are you feeling any profuse sweating or shivering? Are you in pain right now? Thank you.
Next is to assemble the equipments. We have thermometer, thermometer sheath or cover, water-soluble lubricant for rectal temperature. Disposable gloves protects both the nurse and the client, towel for auxiliary temperature. Next, tissues or wipes. Cotton balls, both wet and dry. Alcohol. For the procedure, introduce self and verify the client's identity using agency protocol. Explain to the client what you're going to do, why it is necessary, and how he or she can participate.
So, Assalamualaikum and good morning, ma'am. I am Ramyessa, your nurse for today. May I ask your full name, date of birth, and your age?
Allandra Zya H. I'm 18 years old, April 2017.
Thank you. So, for today, ma'am, we will assess your temperature to know if it is in the normal range.
Perform hand hygiene and observe other appropriate infection control procedure. Apply gloves if performing a rectal temperature. Hand hygiene and the use of gloves reduce the risk of transmission of microorganisms and protect both the client and the nurse from infection. Provide for client's privacy. Maintaining privacy promotes the client's dignity, comfort, and trust during the procedure. Position the client in the appropriate position, such as lateral or Sims position for rectal thermometer. Proper positioning ensures accurate temperature measurement and facilitates safe insertion of the thermometer and promotes client's comfort.
So, ma'am, are you in a comfortable position right now? Okay.
Clean the thermometer using an alcohol swab from stem to bulb in circular motion. Apply a protective sheath or cover and lubricate the rectal thermometer if used. Cleaning the thermometer prevents cross-contamination. Using a probe cover maintains infection control, while lubrication reduces friction and prevents discomfort or injury during rectal insertion. Place the thermometer. For oral, place the tip on either side of the frenulum. This area contains blood vessels that provide an accurate reflection of core body temperature.
Ma'am, can you please open your mouth? I will insert the tip na. Can you close your mouth, ma'am, and then hold the thermometer? Thank you.
For auxiliary, pat the auxiliary dry if moist, and place the tip in the center of the axilla. Drying the axilla prevents cooling effects from moisture and ensures accurate temperature reading. For privacy purposes in this video, we will place the thermometer under the axilla with the shirt on, but in real clinical setting, the tip of the thermometer must be placed under the axilla and at the skin of the axilla.
So, ma'am, I will pat your axilla. And now I will insert the tip of the thermometer.
For rectal, instruct the client to take a slow deep breath during insertion. Never force the thermometer if resistance is felt. Deep breathing relaxes the anal sphincter for easier insertion, and avoiding force prevents injury to rectal tissues. Then wait for the appropriate amount of time. Allowing sufficient time ensures that the thermometer accurately detects and records the client's body temperature.
Electronic and tympanic thermometers will indicate that the reading is complete via a light or tone. Check package instructions for length of time to wait for prior to reading chemical dots or tape thermometers.
Remove the thermometer and read the result at eye level if using a digital thermometer. Reading at eye level ensures accurate interpretation of the temperature measurement.
So ma'am, I will now remove the thermometer.
Then discard the cover or wipe the thermometer with an alcohol swab from bulb to stem. Then remove gloves if used. Proper disposal and cleaning prevents contamination and reduces the spread of microorganisms. Then perform hand hygiene. Hand hygiene after the procedure prevents the transmission of pathogens and maintain infection control. After cleaning the thermometer, return it to the storage location. Proper cleaning and storage maintain the functionality of the equipment and prevent cross-contamination. Then lastly, document the temperature in the client record. Accurate documentation provides a legal record, communicates important information to the healthcare team, and helps monitor changes in the client's condition.
So the temperature of the client is 36.7 degrees Celsius and it is normal.
Good day, I am Nurse Sam. So now, let us move forward to the assessment of the peripheral pulse. But first, let us define what the pulse is. The pulse is a palpable bounding of blood flow noted at various points on the body. The radical and apical location are the most common site for the assessment. The assessment of the peripheral pulse is one of the important data in gathering the client's vital signs. It is performed to determine the pulse rate, rhythm, and volume, which reflects the functioning of the heart and the condition of the blood circulation on the body. There are certain factors that might affect the pulse, such as the gender, age, exercise, fever, medication, hypovolemia, stress, position change, and pathology. Now, let's move on to the demonstration. Nurse Nurhaliza will show the proper technique in assessing the radial pulse while ensuring patient safety, comfort, and accurate measurement. Purposes: to establish baseline data for subsequent evaluation, to identify whether the pulse rate is within normal range, to determine the pulse volume and whether the pulse rhythm is regular, to determine the equality of corresponding peripheral pulses on each side of the body, to monitor and assess changes in the client's health status, to monitor clients at risk for pulse alterations, example, those with a history of heart disease or experiencing cardiac arrhythmias, hemorrhage, acute pain, infusion for large volumes of fluids, or fever, to evaluate blood perfusion to the extremities. Assess clinical signs of cardiovascular alterations such as dyspnea, fatigue, pallor, cyanosis, palpitation, syncope, or impaired peripheral tissue perfusion. Factors that might alter pulse rate, example, emotional status and activity level. Which site is most appropriate for assessment based on the purpose.
Good morning, ma'am. How are you feeling for today?
I'm good.
Are you experiencing any pain or discomfort?
Assemble the equipment. Alcohol for hand hygiene. Watch with a sweep second hand or digital seconds indicator. If using a Doppler ultrasound stethoscope or DUS, assemble the transducer probe, the stethoscope headset, transmission gel, and tissues or wipes. Procedures: introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why is it necessary, and how he or she can participate. This ensures the correct patient receives the procedure and helps the client understand what will happen, which reduces anxiety and promotes cooperation.
Good morning, ma'am. My name is
What's your name, age, and date of birth?
Musaiya, 18 August 11, 2007.
So, ma'am, I will be checking your pulse to determine your current health status.
Perform hand hygiene and observe other appropriate infection control procedures. Provide for client's privacy to maintain the client's dignity and comfort while allowing the nurse to properly assess the pulse site. Select the pulse point. Normally, the radial pulse is taken unless it cannot be exposed or circulation to another body area is to be assessed.
Ma'am, I will assess your radial pulse in your wrist since it's the easiest to access.
Assist the client to a comfortable resting position. When the radial pulse is assessed with the palm facing downward, the client's arm can rest alongside the body or forearm can rest at a 90-degree angle across the chest. For the client who can sit, the forearm can rest across the thigh with the palm of the hand facing downward or inward.
Can you relax your arm for me, ma'am? Are you comfortable?
Palpate and count the pulse. Place 2 or 3 middle fingertips slightly and squarely over the pulse point. Count for 15 seconds and multiply by 4. Record the pulse in beats per minute or BPM on your worksheet. If taking a client's pulse for the first time, if obtaining baseline data, or if the pulse is irregular, count for a full minute. An irregular pulse also requires taking the apical pulse. Note: using thumb is contraindicated because the nurse's thumb has a pulse that could be mistaken for the client's pulse. Assess the pulse rhythm and volume. Assess the pulse rhythm by noting the pattern of the intervals between the beats. A normal pulse has equal time periods between beats. If this is an initial assessment, assess for 1 minute. Assess the pulse volume. A normal pulse can be felt with moderate pressure and the pressure is equal with each beat. A forceful pulse volume is full. An easily obliterated pulse is weak. Record the rhythm and volume on your worksheet. Document the pulse rate, rhythm, and volume and your actions in the client record. Rationale. Documentation provides a permanent record for monitoring the patient's condition and helps other healthcare providers evaluate changes in health status.
The client's pulse rate is 75 beats per minute, the rhythm is regular, and the volume is normal.
Hello everyone, good day. I am Nurse Zya, and for the last assessment will be the assessment of respiration. But first, what is respiration and what is the purpose of assessing the respiration? Respiration is the biological process in which organism passes or exchanges gases between their cells and environment to produce energy. It involves inhaling of oxygen and exhaling of carbon dioxide. Respiration is also known as breathing. Assessing the respiration helps detect respiration distress or failure. It identifies underlying causes of symptoms. It monitors disease progression or improvement. It evaluates effectiveness of treatment. And lastly, it assesses for potential complication. And lastly is the factors affecting respiration: hormones, exercise, temperature, emotion, age, and diseases. And now, Nurse Ali will demonstrate how to assess a respiratory rate. Preparation. Assess skin and mucous membrane color such as cyanosis or pallor. Position assumed for breathing such as use of orthopnic position. Signs of cerebral anoxia such as irritability, restlessness, drowsiness, or loss of consciousness. Chest movements such as retraction between the ribs or above or below sternum. activity tolerance, chest pain, dyspnea, and medications affecting respiratory rate.
Good morning, ma'am. Are you okay?
Yes, po.
So I will be asking a few questions. Kindly say yes if you're experiencing any and no if not. So ma'am, are you often irritable,
No.
sleepy,
No.
tired,
No.
loss of consciousness, or have you fainted?
No.
Are you having any difficulties of performing daily activities of daily living such as walking,
No.
running,
No.
bearing weights,
No.
chest pain,
No.
difficulty of breathing?
No.
Are you currently taking any medication that can affect the respiratory rate?
No.
Next, assemble the equipment. Watch with a sweep second hand or digital seconds indicator and alcohol. Procedure: introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why is it necessary, and how he or she can participate.
Once again, good morning, ma'am. I am Alicia S. Mudjasan and I will be your nurse for today. May I know your name, date of birth, and age?
Zhaida A, Kahaluddin, June 9, 2007, 18 years old age.
So now, I will be assessing your respiratory rate to determine any presence of abnormal sounds, irregular rhythm, and depth for further care and treatment.
Perform hand hygiene and observe other appropriate infection control procedures. Provide for client's privacy. Next, observe or palpate and count the respiratory rate. If you anticipate the client's awareness of respiratory assessment, place a hand against the client's chest to feel the chest movement with breathing, or place the client's arm across the chest and observe the chest movements while supposedly taking the radial pulse.
So there are two ways in counting the respiratory rate. First is by placing your hand over the client's chest. Is it okay? Or second, by placing the arm of the client directly over her chest while supposedly taking the radial pulse.
Count the respiratory rate for 30 seconds if the respirations are regular. Count for 60 seconds if they are irregular. An inhalation and exhalation count as one respiration. Observe the depth, rhythm, and character of respiration. Observe the respiration for depth by watching the movement of the chest. Rationale: during deep respirations, a large volume of air is exchanged. During shallow respiration, a small volume is exchanged. Observe the respirations for regular or irregular rhythm. Rationale: normally respirations are evenly spaced. Observe the character of respiration, the sound they produce, and the effort they require. Rationale: normally respirations are silent and effortless. Lastly, document the respiratory rate, depth, rhythm, and character on the appropriate record.
So the finding, the respiratory rate is 16 breaths per minute. The depth is neither shallow or deep, meaning it's normal. The rhythm is regular and the character is effortless.
That's all for our video presentation on assessment of the vital signs. I hope you learned something new. Good luck on your return demonstration.
Good luck, future RNs! Group C signing off!